Hi, this video is all about tailbone pain. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy. And one of the most important things to do or if you have tailbone pain is to start treating it and making yourself feel better. A pelvic expert physical therapist can absolutely help you do this. But in the meantime, I'm going to give you some self treatment techniques to help you heal your tailbone yourself. Okay, so here is the tailbone. This is the back side of the pelvis. So also look at the butt. It sits right in the crack. Okay. So that's where the tailbone is in your butt crack. All right. So here's tailbone. It's also known as the coccyx. Okay. So this is called the sacrum. So you have your low back here, then you have your sacrum, then you have your coccyx, and then you have your anus, which is right there. Okay, tailbone injury is really common and it can happen after childbirth. It can also happen just from falling on your butt. So it's super common from falling on the butt. Some people will have tailbone pain for years and never get it treated. And so it's really important to get it treated. One of the most common ways when you hurt your tailbone is the joint itself. So the tailbone has some movement, okay? So it moves about 5 to 7 degrees of movement, so in either direction. Um, and the pelvic floor muscles, these are the pelvic floor muscles, they attach to that tailbone, okay? You have some ligaments that also will have some attachments there. To the tailbone and it's the pelvic floor is really important in treating the tailbone and like getting to the root cause of the injury and like fully treating it. So I had someone reach out the other day and they're like, is someone going to have to go in my butt to treat the tailbone, like go inside the anus? And it's a possibility, but there's a lot you can do through the vaginal canal, which is a little bit more comfortable, that can help heal the tailbone. But before we even get to that, that's what a pelvic expert physical therapist will do for you, or someone who does internal pelvic work. But before we even get there, here are some things that are going to help you. So here's tailbone, okay? So typically when you have a baby, the tailbone has to move this direction. And when it moves that direction after you have a baby, you think like, oh, it's stuck in that direction. And that's hardly ever the case. I've never actually seen that. Most of the time, what happens is that the pelvic floor muscles, after you have a baby, there's scar tissue, they recoil, they become more tense, and we actually stop using our pelvic floor as well. And so the muscles just get tighter, and that helps pull the tailbone back, but maybe pull the tailbone too much into this position. We call it counter nutation, the position, but you don't even have to worry about it. There's two positions of the tailbone. One is counter nutation, where it's like the tailbone is stuck up under your butt. And then one is nutation, where the tailbone then like sticks out the other way. Hardly ever see that. Most of the time when people fall on their butt or after they have babies, it gets stuck up and under their butt. Okay. So it might feel like you're sitting on something or you constantly have a bruise in that area. Okay, so the number one way to start to treat that is a few things. We have to, number one, get the pelvic floor to relax. So, how are you going to do that at home? You're going to start to do diaphragmatic breathing. I'm going to demonstrate this. I'm going to hop on the table here. So, I'm at my treatment table. I'll start at home on the bed and I'll put my hands on my belly. I like to bend my knees because that's supportive for my back. It might feel better for your tailbone. You'll inhale into your belly and into your ribs, getting the deepest breath possible. Exhale and let it all go. Deep breath in. Exhale, let it go. Okay, so as you inhale, you want to imagine like you're opening your anus or opening your vagina. That's going to help bring the tailbone out from that tucked up and under position. Okay, so if tailbone is tucked up and under, we need to move it back into its neutral position. So when you inhale, the tailbone and the pelvic floor should be opening, and you should feel that tailbone kind of reaching towards the table, reaching towards the floor. Exhale, you might get some natural recoil. Okay, so you're going to spend 5 minutes a day trying to do this type of opening breath where you're pulling the air in. All the breath into the belly, into the pelvic area is opening vagina and opening anus, helping push tailbone back into its regular place. Let it go. Exhale, things recoil naturally. Okay, that's one of the first things you can do. And then, so spend 5 minutes a day doing that. Then we got to work on some hip mobility. So, and actually, one of the most important things is to get the hips mobile. So, like a lot of times after we have this tailbone injury, things get tight and stiff. So, I recommend doing some self massage, taking a lacrosse ball. Let's see if I have one here, and rubbing it against your butt, against the wall. You're not going to go right on the tailbone, but you're going to go right on that glute. So, right on the butt meat, right? Um, so, here we go. We're taking lacrosse ball and we're just going to work it against the wall, against the glute. Okay. And I'm rubbing the ball against my glute, helping release those muscles. I can go close to the tailbone and get some of the border next to the tailbone, and that's going to help feel relieving. It's going to help open it up. It's going to allow that tailbone to go back into its neutral position. Okay. So that's the second thing. So a couple minutes each side every day is going to help open up those muscles. Then you can follow that with some piriformis stretching or some glute stretching. One way I like to do this is just in the sitting position. Take your leg, cross your leg, sit up nice and tall, and lean forward. You can do a minute each side, do it a couple times each side. So 2 times each side, a minute each side, and then switch, keeping your spine nice and tall as you lean over. And this should not hurt the tailbone. If it does, just be really gentle with it. You might be watching this and think like, oh, my tailbone fractured or it's broken. You want to take special precautions. Some of these movements might not be safe for the healing of your tailbone. So definitely talk to your doctor or talk to your pelvic expert physical therapist to help you on your healing journey with that. So 2 times each side, a couple times a day even, that will be great. So those are the hip stretches, lacrosse ball against the wall, and the breathing. Okay, the next thing I'm going to show you is relieving when you have tailbone pain, but you might not be ready for it. So if it's too uncomfortable, don't do it. But if it feels good, do it. So what you're going to do is you're going to take your own hand and you're going to go right above your anus to where your tailbone is. And then you're just going to pull up towards your head. So what this looks like, and maybe I have to take my poncho off for that, is you're going to take your hand right above your butt, and it's easier to do this right against the skin. You're going to take your hand right against the butt, right above anus. I'm feeling my tailbone right here, and I'm pulling up to my head. So like up this direction, okay? So the angle of my hand is here, and I'm pulling up this direction. And that will feel really good and really relieving if you have tailbone pain. Okay. So, and you can do that multiple times a day to start healing it, to start pulling it in the right direction. This is gonna complement your pelvic floor PT, and I wish you all the best in your healing journey. You might also benefit from kinesio taping. So, if you've seen those like fancy tape on people, sometimes taping the tailbone in that same direction that I just showed you how to move it can feel really good. It's kind of hard when you have a bowel movement and go to wipe to try and like preserve the tape. So you have to retape it quite often or every bowel movement. But that can be really relieving as well. So if you have questions, drop them here. Happy to answer them, and get in touch with the pelvic expert PT. If you've been dealing with tailbone pain for a long time and have always had a sore coccyx or tailbone, please reach out. We do intensive programs where people fly here, spend a couple days with us to a week, and we do extensive long therapy to help get that tailbone back to the right position, relieve the pelvic floor of its issues that are holding the tailbone in the bad position that's causing you all that pain and discomfort, and then we release it and help your hip mobility, and you generally feel really good after that, and you're good for life. So all right, hope that helps. Take care.